Using a scope to get stones out of the urinary tract in the ureter and kidney is one of the fastest evolving technologies in all of urology. Let's talk about ureteroscopy. Let's talk about all the details of it and how it can help you. Hey guys, Dr. Segel here. So the question is, my doctor says he's going to use a tiny scope and get stones out of my urinary tract. Is my urologist from the future? How's he going to do this? So he might be from the future, or he or she might be from the future. I don't know. But let's talk about ureteroscopy, how it's done, how it can help you, when we do it, all those details, so you're more prepared when you have your procedure done. Guys, and at the end, I'm going to talk to you about kind of my pearl of wisdom, the most important tip for success after ureteroscopy. So make sure you stay tuned for that. First of all, ureteroscopy, we put a scope into the bladder, okay? And then we access the ureter. The ureter is the tube that drains urine from the kidney down to the bladder. So this is a stone in the ureter. We'll advance this scope to that stone, and then we'll begin to work on it. We have a couple different kinds of scopes that we can use. We have rigid scopes, which are good for stones in the ureter itself. We have flexible scopes, which are longer and can access stones in the kidney. So this gives us the capability of treating stones in the ureter with a rigid scope, in the kidney with a flexible scope, or both simultaneously if you want to use both scopes. In addition, sometimes these stones will travel towards the kidney, and when they travel towards the kidney, we can change the rigid scope out for a flexible scope. So it gives us a lot of flexibility with how we can access these different stones, the fact that we have two different kinds of scopes. One of the nice things about the scope is that we can fit laser fibers that are very small but very powerful through the scope. So a very common way that we treat the stone is we advance the scope to the stone. You can't just pull the stone out. I mean, Mother Nature already proved that. The stone's stuck there. So we'll use a very small laser fiber, sometimes as small as just 200 microns, to bust up this stone. And we'll free it up and oftentimes can laser it to render it to be just small sand-like particles that will wash out. In fact, these lasers are so powerful now. I've been in practice about 10 years, and stones that we were working on in the kidney, burying through the kidney with a tube in the side and getting these stones out, now we can oftentimes treat those stones with a scope from below, a ureteroscopy, because the laser fibers are far more powerful now than they've ever been in the past. So working on these stones is much more feasible with a strong laser that can bust it up quickly. So that is one of the neatest things I've seen in urology, is the power of the laser fibers, and the laser machines that we use. The scope is nice too because we can use a variety of tools through the scope. Not only a laser fiber, but we have what are called baskets. So we can grab these stone fragments out for a couple reasons. One, if we're lasering a bunch of these stones and we're rendering it to sand-like particles, and I look at that fragment, I say, you know what, it's going to wash out without a problem. That's one thing, and that's great. But sometimes we'll look at it and say, I don't know if they're going to be able to pass that little fragment. So we'll want to pull it out. And so we have a ureteroscopic basket, where it looks just like a basket that you may see, at the supermarket, but it's got a closed top to it, and we can grab that stone and pull it out. That's one example, but there's a lot of different tools that we can use through the ureteroscope that are just a millimeter thick, which is pretty remarkable to get rid of stones that may not ordinarily wash out. One thing that's about ureteroscopy that I think a lot of people should know is that sometimes we can't treat the stone in totality, the whole stone on the first go around. We have a whole another video about that, because the stone may be stuck in the ureter, and oftentimes what we do in that situation is we'll put a stent that goes from the kidney down to the bladder, opens up that ureter, and so the initial work that we did on the stone, we'll have to bring them back and do some more work on it. But ureteroscopy allows for that in a sort of a minimally invasive way, because this is a no incision technique. Oftentimes when, I've had patients that have had stone surgeries in the 80s, 90s, and I tell them that we're going to do a procedure to get stone out. They're like, Doc, don't cut me again, because the last person cut me to get the stone out. And that's the way we did things a while ago because we didn't have all these fancy scopes and techniques to be able to get stones out of the urinary tract. So this is truly a no incision technique. We look in the bladder with a camera. We use the smaller scope to get into the ureter, to find that stone, apply lasers to it, get out the big fragments. So that's nice. There's not a lot of techniques in surgery that are truly no incision, but this is one of them. One thing that people should know too is, in general, and every institution is different, every hospital is different, every anesthesia team is different, but in general, ureteroscopy, what we're talking about here, requires general anesthesia. So it's not without risk. Certainly the procedure carries risk in and of itself. Damage to any urinary structure, bleeding, infection, need for additional procedures, scar tissue formation. All those things are possibilities, although relatively uncommon. But general anesthesia is oftentimes required with this because the ureter is a very sensitive place, so it's difficult to get the patient to stay still just with sedation. So when people think about a no incision technique with a scope, oftentimes they'll associate it with a sedation or twilight procedure, and sometimes it is, but oftentimes it's general anesthesia. So I just kind of want people to have that in their mind so they're not surprised on the day of the procedure when they learn that they're going to be getting general anesthesia for this. One of the things that's nice too about some of the tools that we have available to us during ureteroscopy is that sometimes this scope that we insert in the ureter, okay, we insert it in the ureter here, it's just a little bit too big for the ureter, but we have some soft dilators that we can use to stretch up the ureter intraoperatively in the operating room so that it becomes big enough that we can actually accommodate that scope. So that's a nice thing because when we didn't have such dilators a long time ago, we try to put the scope up. We couldn't get the scope up. We'll say, you know what, Jim, we got to bring you back for another procedure. But now we have the opportunity to, in a relatively safe way, dilate that ureter up to a caliber that the scope can fit through there. So that possibility exists when we do ureteroscopy too. And so this is kind of the pearl of wisdom, the thing I want to tell you guys about that I think is the most important success tip after ureteroscopy. It's very important that we leave the ureter dilated in some way, shape, or form after ureteroscopy, because when we work on these stones, we're rendering them to be sand-like particles, but they can still get stuck on the way down. A couple different ways that we do this. One is we leave the stent in. The stent opens up this ureter, makes it nice and wide so that when we take it out, these fragments can easily wash out. So that's one way we allow that ureter to stay open so those fragments can wash out. The other way we do it is put a patient on Flomax or medication like it. This medication will relax the smooth muscle, open up the ureter, those fragments can wash out more easily. So the tip that I'm trying to convey to you is this. Your urologist is going to give you recommendations for how long to keep the stent in, and also whether you should be on Flomax afterwards. Listen to them, because those are vitally important maneuvers that you can employ so that you're less likely to have an obstruction afterwards, because those will keep that ureter nice and open. So that's my kind of tip for success after ureteroscopy. Follow your urologist's advice for methods to keep the ureter passively open, okay? I hope that's helpful to you. I hope that gives you some framework for how to understand ureteroscopy, the details of it, why we do it, what to expect, etc. Thank you so much for listening. We certainly appreciate it. Please subscribe to our channel. Thanks.